understand, like, how did young startup just in over 2.5, 3 years scale up, leveraging digital public infrastructure, and then what were the learnings also as you kind of really scale up?
Thanks. Thank you so much, and thanks for inviting me here. Maybe post-lunch session, I'm going to go the other side where I would like to ask a question to all the audience, maybe just raise hands. How many of you have actually seen your medical records or your vitals, maybe if you are healthy, your parents' vitals or your kids' vaccination records, in the way you follow the GDP of countries in a graphical, digital manner? Raise of hands. Okay, none. I expected a couple of them, but that's what Eka Care is here. That's my startup to solve for, and we believe that when it is about health, nothing else matters. And incidentally, some of the stories that has happened in my family as well has led to what we are trying to do. And I think as we can see from these audience itself, the healthcare provider, which is the doctors, eventually you cannot give yourself care, but the doctors should read that data pretty carefully. Now, coming to the question, how the DPI is helping us achieve this. So a small presentation just here. What we believe at Eka Care today is we are hitting a moment of UPI in healthcare. Right? All of you know that UPI has actually taken leaps and bounds on the financial ecosystem. And that is what the digital public infrastructure today is gearing up to transform the healthcare. So look at this slide. The left side is how the UPI apps today operates in our country, where there is an NPCI rails, and then they connect to the banking systems, as well as there are front-facing applications. A similar experience now is built using the digital public infrastructure called UHI, ABDM, is Ayushman Bharat Digital Mission, where the healthcare service providers, such as the ones mentioned here, are connected to the rails. And hence the delivery of the documents, the delivery of teleconsultation, the delivery of all kind of health services would be driven leveraging the PHR, which is personal health record applications on the various stores as well as on the web. And I think that is transforming the way we are building Eka Care. Can we go to the next? The architecture is pretty federated. If you look at it, all kinds of privacy-related use cases have been looked up while building this. There is an individual ID that we spoke about in the earlier sessions as well, called Abha, which is Ayushman Bharat Health Account. Now, this ID is something that will make sure that the interaction and the integration happens for that specific individual. What eventually this means is the control of the health data would remain with us as an individuals who are taking care of their health, and they are all free to share this data with whoever they wish to. And again, the architecture is such that the ownership is either with the user or with a healthcare provider who has generated the data. The intermediaries are somebody who cannot get through this information. So this is a fundamental shift in the way healthcare is getting delivered. At least in India, this is the initiative that we are super bullish about. Eka Care as a platform is one of the largest PHR app. Our innovation is to bring these medical information in the hands of the user so that they can share that necessarily with all the parties that they wish to. How it is helping to shape the startup ecosystem is, think about like 2015-16 when UPI was in the nascent stage in our country. Suddenly you see that two sides of the network. One is the provider network, which is banks, is coming up on a level playing field, and then on the other side, consumers are also now getting access to these services right from their mobile phone. This is what is happening with this architecture as well. health is a far more complex subject. It's far more fragmented than what we see in fintech. Fintech, we have got say 400 banks, but here there are 70,000 plus healthcare services and 1.4 million doctors and so on and so forth. So pretty complex. Because of this infrastructure, all of these fragmented healthcare providers are coming onto the network, and us innovators are able to leverage use cases and are innovating use cases for users by ensuring that we are part of this network. So that's a big fundamental shift in the way healthcare startups are now building innovations on. And I think that's, I believe, is all possible because of this digital public infrastructure. Again, in the nascent stages right now, when we compare it with Aadhaar or UPI or many other large digital public infrastructures. But I am super confident that this would change the way healthcare services are delivered, and we would like to be a big innovator in this journey to solve for this use case. So the next time, maybe when I'm meeting with you, you all should raise hands that, okay, now we can see our medical data and vitals electronically in a graphical fashion, because eventually health is what matters the most. Rest everything is later. Thank you. Thank you.
Thank you, Vikalp. Thank you for sharing the whole platform approach. Let me come over to Sohail. Sohail, you represent Bill and Melinda Gates Foundation, and you have been pretty much actively involved, for sure I know in India, around enabling